right now on News Channel 8 at 6.
A new treatment for prostate cancer being tested right here in the Bay Area. How it's helping to save lives.
It's treatment for prostate cancer being tested on patients locally. How it's helping to save lives.
Well, it is one of the most common cancers among men in America.
Talking about prostate cancer here, but there is a promising new treatment being tested here in the Bay Area. We're going to show you how it is helping our patients when we come back.
A lot of men avoid going to the doctor, and ahead of Father's Day, 8 on Your Side wants to remind dads out there they need to take care of themselves. Prostate cancer is the second most common cancer among men in the United States. And a cutting-edge treatment that could save lives, well, it was tested right here in the Bay Area. 8 on Your Side's John Rogers joins us now live to tell us about SpaceOAR. Interesting name, John. Do tell us more.
Yeah, it certainly is interesting. It was actually tested here in Lakewood Ranch and in Sarasota. It's the first of its kind, revolutionary, and SpaceOAR can transform prostate cancer treatment. 3 years ago, Bill Nagler was diagnosed with prostate cancer. He immediately sought treatment and worried about the side effects.
And I've seen too many other people that had surgery, and their lives just didn't seem to be the same.
Prostate cancer kills tens of thousands of men each year.
If left untreated, can spread to the bone, to the lymph nodes, to the lung, and it's the second leading killer of men in terms of cancers.
World-renowned oncologist Dr. Sylvester says one problem with radiation treatment is it could potentially damage surrounding organs, like the rectum. So that's where the SpaceOAR comes in. It stands for Space Organs at Risk. It's a gel inserted by needle that creates a protective barrier to separate the prostate from the rectum.
The biggest advantage of this will be able to allow us to give a higher dose of radiation. And the higher the dose, the better the cure rate.
Could potentially save more lives.
Exactly.
The painless gel wall remains for about 3 months. That's plenty of time for radiation treatment. It then dissolves and the body naturally gets rid of it.
I think I was extremely fortunate.
Nagler feels the SpaceOAR treatment played a critical role in saving his life.
I think every single person should take this as the first option.
Now that clinical trials in Tampa Bay are over, it's FDA approved, and it can potentially save many more lives. And officials say that using SpaceOAR can also lead to, of course, increased radiation treatments, and that could mean fewer visits to the doctor, which overall could mean lower healthcare costs. Back to you, Stacey.
Good news on every level. And John, here's a good question. If people don't know, at what age should men start getting checked for prostate cancer?
Yeah, great information. I talked to Dr. Sylvester about that. He said you should start seriously looking into it and getting tested at age 40, especially if you have a family history. And it's important not to wait for symptoms because by then, the cancer could already be in advanced stages.
Good information, and just ahead of Father's Day, a good time to think about those types of things. Thank you. John Rogers live in Manatee County. Thanks.